So I'm going to describe what we've done so far. It's just the beginning, looking at racial disparities in maternal morbidity here at Duke. So I have no disclosures, but some of this work is funded from FAIR and the Duke CTSA. So maternal morbidity is basically any event that happens to an obstetric patient, to a mom who's giving birth at the time of delivery that might have short-term outcomes for her health or long-term outcomes. So you can see over here on the right, these morbidity events as defined by the CDC are anything from basically a heart attack, kidney failure, stroke, complications from the anesthesia, needing to have your uterus removed because of severe bleeding or infection. What the CDC has showed us is that morbidity occurs more commonly in Black patients in America than in white patients. So I'm sure you've all heard that the death rate of a Black patient in America when she's giving birth is 3 times that of a white woman. So death is not a common outcome, but these peri-death, before death, precursor events, morbidities, are also an issue, and probably a greater issue and more so in Black patients than white patients. So we aimed to look just at Duke at the rate of our maternal morbidity in Black patients compared to white patients, and to look at different payer status. So our hypothesis was that Black patients with Medicaid would have more morbidity events compared to white patients. So this was a cross-sectional observational study of deliveries at Duke. So we're a referral center, so we get the sickest patients in North Carolina over this 5-year period from January 2016 to 2020. We looked at patients that were self-identified and recorded in the EMR as Black and white, and that had Medicaid or private insurance. Our primary outcome was the ICD codes and procedure codes for the CDC-defined maternal morbidity events at hospitalization or readmission within a year. We looked at all deliveries using the procedure and ICD codes. We did not include blood transfusion. Blood transfusion is one of the most common morbidity events, but we wanted to look at other organ system dysfunction. So the groups were compared with a chi-square test, and we used logistic regression to estimate the odds of maternal morbidity, and we adjusted for age, obesity, and the route of delivery. So that's important because C-section is surgery and a vaginal delivery is not. So there is a much higher risk of infection and bleeding and complications when a woman delivers via cesarean than vaginally. So what we saw across the 4 populations is that Black patients were overall younger than white patients. Black women had more cesareans, which is going to confer more risk, so we have to adjust for that. And Black patients have more obesity compared to white patients and end up with more C-sections compared to white patients. So if we looked at non-transfusion morbidity, Black patients, 4% of them overall basically had a morbidity event compared to about 2% of white patients. So that's double. And so when we did our adjusted analysis, we saw that Black Medicaid patients were over twice as likely to experience non-transfusion morbidity compared to white patients with private insurance here at our home institution. So the next steps would be to use the electronic health record and artificial intelligence to develop models to predict who is going to develop severe maternal morbidity so that we can add interventions to specific types of morbidity events to prevent them in women.